everyone, and welcome to another edition of Doc Talk with Monument Health. Today, we are talking with, and I'm going to need you to explain this to me, Dr. Saverio Barbera, an electrophysiologist. That is an impressive word. And I can't imagine that what you do is also follows up with how big that is.
Wow. Some people think I remove hair and that it's electrolysis. But I do heart rhythm treatment, and that's probably, a more mainstream way to describe my specialty. I'm a heart rhythm doctor.
Okay.
And so I just got into this when I was probably around 30. I started to figure out that I was going to point the rest of my training in that direction, and took a few more years. And then I was a heart rhythm specialist by the end of the, 4 years. And I was 34, and I was training down in Texas to get this degree. And, the field has gone unbelievable, berserk, just like electronics in the world have exploded over the last 20 years. The field of cardiac electrophysiology has come along just so similarly, because what we're dealing with is electronics inside the body. And that involves sometimes treating heart rhythms that are too slow with pacemakers, which is an electrical, a device. It's a computer with some wires attached to the end of it that go to the heart. And then there's rapid heartbeat problems where we have defibrillators, which we use to sometimes shock people out of rapid arrhythmias. But we also now, and this has really come incredibly advanced over the 20 years. I've never seen any field in medicine do this, but we can fix electrical problems in the heart by burning or freezing heart tissue to stop hearts from racing, stop hearts from skipping, and stop them from what we call fibrillating. So that's cardiac electrophysiology, heart rhythm.
That's what you've seen over the past, like you said, 20 years, going back to the time when we were just learning really what the heart does, I suppose, to what you know now. That has to be just amazing, like you said, with electronics that we have and how quickly those change, how much we've learned about the heart in that short period of time.
I was seeing a bunch of patients in the office today, and a lot of them had atrial fibrillation, the most common heart rhythm problem that people can have. And a lot of times they'll ask me about, how this has changed over time. And today they were asking me, I was describing to them back in 2002, and I was out on Long Island in New York. And I was brought there from Texas, where I had done my training, and I was being asked to do AFib ablations then. And we just started doing them. And the patients asked me, what was it like, when you first started practicing doing these procedures versus now? And, the first thing I'll tell them is how long it took to do it. We're trying to do the same thing, but instead of taking 5-6 hours, it takes an hour, maybe an hour and a half to get it done. Sometimes it can be a little longer, and that, if it does happen, there are cases that are complicated even more than the average. But in a straightforward patient, you can be done in an hour and a half. So that's, 4 or 5 times faster in 20 years than we used to go in terms of just getting the job accomplished. But more important is success and safety.
Yeah.
So safety, probably you would put that first. And this procedure used to have a chance of harming someone of a few percent. But now, we're talking 1 in several hundreds.
That's amazing.
And so the safety factor's gone to a new level. So we'll take it on more. And in the past, if you knew that you had a chance of harming somebody, you really had to have a big reason to put somebody's life on the line. That had to be really a problem. But now we can do this with very little risk. And so the indications become more expanded. And then the efficacy of the procedure has
Right.
has really gotten good too. So we used to be 50-50 really on a fix. Now, it's 90% on somebody who doesn't have advanced or very difficult if you catch it early.
Sure.
So we are moving towards trying to get people early, because the downside to the AFib ablations that are still existing are the ones that we got too late.
Yeah.
They've been too far along in that heart rhythm problem. So technology has gone great, and we're actually expanded the indications for us to proceed with more. And so the guidelines of the American Heart Association guidelines and things that we use to follow, that panels of people get together, experts, and we go over what's the right indication for these procedures. And as the technological advancements have come along, we have expanded the population of patients that we are fixing, and so it's really become a lot of fun.
It seems to be just an amazing field, and how far you guys have come, and the reason why we're having you in for this podcast today as we get ready for the holidays was when I saw what the topic was going to be when we were getting ready to talk about this. Yeah. At first, when you see these two phrases together, you think, well, this is going to be a Hallmark story that we're going to be talking about in here, right? Because the term, and I just can't believe I had never heard this before, and you and I were talking before we got started that I don't know if a lot of people are familiar with the term, but we're going to explain to them that this is a big deal that you need to watch out for, and it's called the holiday heart. Mm-hmm. And I'll let you take it from there, because it's pretty... It's fascinating and a little scary.
Yeah, I'll use an anecdote, and it'll be myself, because I had holiday heart, believe it or not.
Okay.
I'm also a client. It was on my honeymoon when I was about 26 years of age. But I'm going to come back to that. First, I'll just tell you what basically it is. Every holiday season, or weekend even, you can call that a holiday. There's,
sure,
I think in Great Britain, they say, I'm on holiday. Right. Meanwhile, that just means I'm pounding. But the people indulge overly in food and in excitement, and then also in drink. Usually alcohol is the one of the biggest stimulants. So holiday heart usually will involve some consumption of alcohol. And you might have somebody who doesn't drink ordinarily and doesn't have any heart problems, who suddenly is hitting it hard with company. And, a couple hours after their meal, they'll just feel like there's a hamster running around in their chest, and they don't feel right. And they think they may be having a heart attack. And they come into the emergency room, and they are found to have a heart rhythm abnormality that I just talked about, called atrial fibrillation. But you could have other ones. You can have just skipped beats from the upper chambers. That's called premature atrial contractions. Or you can have skipped beats from the lower chambers, premature ventricular contraction. Or you can have what we call supraventricular tachycardia, or even ventricular tachycardia. These are upper chamber, lower chamber rapid heartbeats. But most commonly it's AFib, and they're people that didn't have a heart condition to begin with. They just... they were on holiday, and they were having too much holiday, and so they got sick. And it usually resolves. It's like having a really bad hangover. We give them fluids and some electrolytes, and usually their potassiums are off, their magnesiums might be off, and they've got just dehydration, because alcohol do that to you. And they're initially overly salted, and their heart stretched a bit because of the overhydration, oversalt intake, and that'll all, be shifting around as the hours pass, as the person is kind of coming through their hangover state, which people, I'm sure many of the people out here can relate. And it's something that we see. Now, getting back to my story, I learned about it firsthand, because I was in Jamaica, not Queens, but the islands, on my honeymoon back. I was age 26, healthy, nothing wrong, very active, athletic type, we were having fun at the poolside with a lot of other couples that had just been married, and we were all drinking and playing volleyball in the pool, and it was really warm and hot, and there was a bar in the pool, and we would go take a break and run over to the bar and chug a cold beer and then get back to the volleyball. And the cold beer went down my warm esophagus. And all of a sudden after that, I felt out of rhythm. And what had happened, I became more and more understanding of this as I hadn't been trained yet in this field, so I really didn't know then what was going on. But in retrospect now, I know what happened. I tickled my heart into AFib with the cold substance. And I saw a person in the office yesterday who had done that too, with not with a cold beer, but with a cold glass of ice water in July. He had a monitor that I had implanted, and it showed the AFib that happened, and it happened right after he chugged cold ice water. And so that's another form of arrhythmia condition that can happen that isn't necessarily as a result of an underlying disease state. It's just the circumstances. It's a circumstantial heart rhythm problem.
I'm so surprised by what simple foods can do to your heart. And I think a lot of people, what's happening to them and what you're describing, I don't think most of them would be like, well, something's wrong with my heart, because I don't think they associate the two. Yeah. And I think that can be kind of dangerous in this situation, right. Can it?
No, absolutely. It's, there's overdoing it with caffeinated beverages, with sports drinks.
Like the energy drinks and things like that too, those ones that can get just...
Red Bull, Monster, and uppers, downers. People do the Red Bull vodkas.
Sure.
And they're really playing, ping pong with their heart's electronic system.
So can this be something permanent? I mean, can it be that dangerous if it's not watched
Thankfully, it's usually limited to that experience, and it doesn't become a recurrent problem. Mm-hmm. But sometimes in patients who, for example, if they don't seek help and they stayed in it,
right?
They were just so hungover and they were just totally inebriated, and they stayed home and they lived in the arrhythmia for that night, the next day, and maybe they're big-chested. They don't really feel the irregularity. A certain percentage of people who have atrial fib, for example, don't feel it, 30% or so. They don't even know they're in AFib. So maybe they don't get a doctor's evaluation. They don't see anybody. They don't know that their pulse is out of rhythm, and they can walk around for a month, maybe 2 months, before maybe then they start going, I'm out of gas.
Yeah.
And I don't know what's this been ever since over the past month or so, that big party. And they show up, and now a month's worth of heart rhythm abnormality persisting like that can actually start to do some damage. So because we know that atrial fib can lead to atrial fib. So meaning it's like a vicious cycle. So that person may start to have taken on damage, and their atria start to get enlarged. Their upper chambers of their heart can start to get sick, and now it's not as easy to fix.
Okay. Once it reaches that certain stage, then it
may get stuck in there.
So what is that, if you can describe, what would a typical holiday heart feeling be? Is there certain similar things that everybody be like, okay, if this is happening?
Most commonly, it's going to be palpitations, which is an uncomfortable awareness of your heart beating in your chest. It doesn't feel normal. Normally we don't feel our heart beating in our chest. We're just living and we're active and we don't even know it's there. But if you suddenly start noticing that, there's a reverberation off your chest wall, that would be one of the most common symptoms. You can also feel short of breath, just not really able to catch your wind. You're going up the stairs and you can't catch your breath as easy as you normally would, or you just feel exhausted. You may maybe feel a little lightheaded. These would be the potential symptoms of a heart rhythm abnormality. But again, the most common would be palpitations.
If they start to experience these, then what's the first thing they should do, doctor?
Well, if you're in the midst of a holiday and you feel like your heart is skipping around, all of a sudden it never was doing it before, and it's not letting up. And you've had something, some water, and it's not, it's still going, and the night is getting old, and you're still like feeling funny. Maybe you don't have chest pain, but if you have chest pain, you're going to be a little bit more quick to get to help. But if it's just a skipping, you can give it a little time. But that's something that eventually you're going to need to head over to an urgent care center, a ER, and get a check in. At that point, they'll probably put you on a monitor, and they might at that point make the discovery of your arrhythmia condition. And you get treatment from that point.
Now, we've talked quite a bit about AFib in describing the holiday heart, and a lot of people might really have started to understand what this condition is because of the technologies that we have now, one being smartwatches, right? Are you behind those? Do you recommend those?
I sure do.
As you you look at yours, I look at mine.
Check mine. 79 beats a minute. I'm excited. Yeah.
So are they pretty? Speaking specifically of the Apple Watch, and they have the what checks for an AFib. It can literally check.
Yeah.
Are they pretty accurate?
Auto detection. Yeah. Oh, unbelievable.
Really?
It's an incredibly smart watch. It really can tell you that your heart's out of rhythm. If you have to turn that on.
Correct.
You've got to be on the lookout for it. And many young, otherwise healthy people aren't looking need to necessarily have that turned on. But what you could do, though, even if you don't have it turned on and you feel symptoms, is you can then record an EKG, playing with the crown of the device and, your app on your phone. You can make a PDF file, a 30-second snapshot of what rhythm you have at that point. That's very helpful for the providers that are going to evaluate this because they can really see what was going on when you felt what you felt.
I see. Okay.
So very good to correlate the clinical symptom with what a patient has on monitor. So that Apple Watch, it's right on you. You can use that. There's another technology that's great for patients who may be in a little bit more of a higher risk group for the development of AFib, and it's called the Cardia.
Okay.
I'm not sure if you're familiar with this.
No.
So the Cardia is something you can buy on, say, for example, Amazon. It's a pair of electrodes that's on a flat panel, little tin electrodes that you can put your fingers on. And so one finger on one side, one finger on the other. And that will be like being hooked up to a surface electrocardiogram. And then that'll Bluetooth to your smartphone, the recordings. And so you'll get a really beautiful EKG of what's going on at the time. So, for example, my mom... She's also a client as well. She has the Cardia because she had AFib, and we're trying to get her away from needing to be on the blood thinners because it was ablated and it's been fixed. She's doing great, but we're worried because she's older, and so we want to make sure we're not missing potentially silent AFib, or sometimes she gets symptoms. She's a little bit on the nervous side. So I'll say, Mom, just hook up to the Cardia and send me the PDF file, and I can see whether she's having AFib.
It's amazing.
So right there from 1,700 miles away, I'm pretty much hooked up. She's on a tele monitor. So it's really useful, these smart watches and technology like the Cardia. Even Fitbits are great. They can tell you what your heart rate is sometimes. If it's, you shouldn't have a heart rate, for example. Typically, it wouldn't get, even on exercise, faster than about 220 minus your age. So it's the maximum predicted heart rate.
Oh, wow. That's much higher than I thought.
You thought it was going to be lower.
I thought you would want it even as your most active. Not quite that high, but
So, yeah, I mean, for example, a 40-year-old, if you're exercising and your heart rate goes to 200,
That's not good.
That's probably meaning
Okay.
that's not a normal rhythm. That's not a physiologic response to the exercise.
Got it.
So people can use their Fitbits and other heart rate monitors. These are not recording rhythm necessarily. They're not giving you the shape of the electrocardiogram, but they at least are telling you what the pulse rate is.
Yeah.
And so, a 70-year-old, if their pulse is 180, that's not normal.
Right.
Something's wrong. So even if they don't have the sophisticated abilities with an Apple Watch, a simpler pulse counting watch can sometimes be helpful too.
It is. It's and when you do on your phone, when you're checking your heart rhythm, you'll see at the end of it, it'll say that you have a sinus rhythm.
Yes.
Correct?
Yes.
And that, when I first saw it, I thought, oh God, what is that sinus rhythm? What does that mean?
Oh, no.
Do I need to go? Yeah. But that means that's good. That's what you want to
good.
see.
Yeah.
Right.
As a matter of fact, I have a friend who started a business on Long Island, and he called it sinus rhythm. He was in the heart rhythm
that's
business,
great.
and he's
Yeah.
like, "But I'm sick of this stuff." He was a rep for Medtronic Corporation, sold devices, and he's like, "I just want to retire and build houses in the Hamptons and just hang out, and I'm going to call my company Sinus Rhythm."
That's great.
I don't think a lot of people knew what the heck he was talking
exactly.
about, Kevin, but yeah, I think
that's
he did.
good.
He did form that company.
So as we get into the holidays, please watch for the holiday heart. Dr. Barbera, thank you so much for coming in and talking with me. And
a pleasure.
if we can ever have another conversation of something that is as cutely named again, I would love to talk with you.
I'll look for some of those.
Thank you very much.
Great. Thanks a lot.